Hello? There we go. It's all going to be so much louder. Good afternoon, everyone. I'm Truchil. I'm the Associate Director for Data Research and Evaluation at the Camden Coalition. And I always joke that you can tell the data-minded people by our adamant refusal to wear ties and jackets, and especially on a Saturday. But I applaud so many people in the room for looking so good on Saturday. But anyway, I'm here representing the Camden Coalition, which is a coalition of roughly 25 hospitals, primary care health providers, community organizations that are working to improve quality of healthcare in Camden, New Jersey, particularly for the most vulnerable patients. Our work falls into the field of population health, which everyone knows is a fairly new and emerging field, and there really is no manual for how to do this, unfortunately. And so we've been forced to innovate and come up with new models for improving healthcare, and so innovation has been really at the core of what we've been working on. So for the past 10 years, we've been working with our partners to improve the quality, the capacity, the coordination, the efficiency, and the accessibility of the healthcare system in Camden. And what I'm here to talk about today is how we've been using smart data, which we really think is essential in that process of innovation. So, but before we get to that, there's really no business case for how do we improve quality while simultaneously lowering costs, to date. And so we've been forced to be entrepreneurial in that sense as well. And so with many of our partners who are in this room, we passed the Medicaid ACO demonstration project, which laid out a framework for paying for the population health work that we're trying to accomplish and allowing us to realize the savings from the innovation that we're putting in place. We've now signed two contracts with the two biggest Medicaid managed care organizations in Camden, and are covering roughly 35,000 covered lives, which for us is a tremendous opportunity to begin to enact change. So thinking about where do we begin, there's so many problems, as you guys have heard today, with the healthcare system, that just trying to figure out how to entangle them, prioritize them, that's a pretty daunting proposition. And so coming up with a cohesive and accomplishable agenda has been a challenge. But on our end, using data as an objectionable and neutral way to help set the agenda has really been at the core of building a coalition that's robust and has coalesced around this common vision of improving quality and reducing costs. So on our side, we started this venture by uniting the three health systems in Camden to begin sharing their data in what was an unprecedented manner in about 10 years ago. So turning over their claims data, which is their core business intelligence tool, which we as analog to Kmart and Walmart and Target all getting together, starting to think about how they could collectively deliver a higher quality product at lower cost that would ultimately mean selling fewer goods collectively. So really that was a profound opportunity to start to have a conversation over how do we deal with our fragmented, expensive healthcare system. And really profound insights and stories began to emerge, and that's been at the core of this coalition that we're working on building. And so the one story that I think it resonates strongly, and you've heard many people speak about, but bears mentioning, is that in a city of roughly 77,000 people that Camden has, we're spending over $110 million just on hospital-based care. So a tremendous amount of money. It's paid for predominantly by Medicaid and Medicare, so tax dollars. And more importantly, what we're seeing is that this small subset of individuals that are consuming a disproportionate share of resources, the 1% consuming 30% of healthcare costs. And we saw this as a really powerful opportunity to break out the problem and prioritize and start to see how can we make manageable change within this subpopulation. So the one strategy that we've been focusing on heavily is this community-based multidisciplinary care management team style that goes out and meets patients at the hospitals, some of the most complex, challenging patients, and really works to empower them and improve their care and meet them at wherever they are and help them navigate the patchwork healthcare and social service landscape that we know that exists in our system. And so there really haven't been, care management's a relatively new field. We actually had the opportunity of hearing from Ken earlier today, who's one of the gurus, but there really is a dearth of evidence and models as far as how do we create and operationalize and scale care management. So we've been forced to tinker, iterate, and innovate in that space. And there's really a need to adopt business best practices around continuous improvement, and how do we use data to drive that work. So the Camden Coalition's growth from roughly 5 people when I started 6 years ago to over 70 has really been a testament to how our message resonates and how we've been using data to drive our innovation. And in that process, we've learned many valuable lessons, some good, some bad, about how to innovate in this space. And so with that, I look forward to the dialogue that emerges in this panel.
So we'll stick